Makram, we know that the world needs to come together, work together, not just for refugees' sake and asylum seekers' sake, but just to be able to get over this pandemic to begin with. But if we're talking specifically about refugees and asylum seekers, of course, Lebanon hosts and has for many years hosted, for example, Palestinian refugees and even now Syrians as well, I believe. Do you think that a country like Lebanon needs the international help to be able to deal with now an extra issue on top of the fact that it's hosted so many, and to try to work out how to deal with this pandemic?
This is certainly the case. However, this international help will not go far as long as the Lebanese government does not acknowledge that it has refugees in Lebanon. It deals with this as if this is a problem that will go away on its own, and thus they don't have a long-term strategic vision nor a sustainable, transparent plan to answer the challenge of the refugees, be it the Syrian refugees, who over the last almost 9 years, there have been requests from the international community for Lebanon to field a clear roadmap to how to deal with this, and accordingly, money will be dispensed. The problem is not the refugees, nor the coronavirus, I think. In many of the countries which are suffering from the corona epidemic now, or conflict in general, there's an intrinsic structural problem which needs to be addressed, and thus any future challenge, be it a pandemic or a future war, can be averted.
Makram, let's talk about this and the way that refugees in Lebanon, for example, live. Do you believe that if there were to be an outbreak there, how bad would that be? Not just within the camps or within the areas that these refugees live, but how bad would that be for just the average Lebanese?
Certainly it would be catastrophic, because the Covid-19 proved that there's no actual boundaries, be it international nor local. And this idea that a virus which, despite Trump keeps on calling it Chinese, even if it's charted in China, it can be a danger in Beirut or a danger in Washington, D.C. or anywhere else. Certainly the problem or dealing with this coronavirus by telling people to quarantine and to stay home cannot be implemented on the refugees, simply because they don't have homes. And these all instructional videos that tell us how to wash our hands, these people don't have running water nor indoor plumbing. And this is certainly the case because many of the countries, including Lebanon, has made it clear that the refugees are not welcome here. Some of the Gulf countries have been very aggressive in dealing with the coronavirus, and one of the main issues it started with that there's no such thing as native and a guest there. So all people who reside within the border should be treated as equal, specifically when it comes to healthcare and it comes to these services. So as I mentioned, any potential outbreak in these camps, and I think there are outbreaks in these camps, but they are not diagnosed yet. And the problem that there's no trust between the citizens and the government of Lebanon for them to give us actually transparent and accurate data. And this is the problem. This is where the problem starts. And I think what applies in Lebanon applies to a number of institutions that call themselves states, be it Syria or even Iraq or even Iran. We don't have this trust, which is very much needed, and this kind of unity between the people and the government to confront this existential threat, not only to the Lebanese, but also to humanity.